multiple healthcare policy initiatives as well. Fun fact, he's also an EMT and started his career actually in patient care, like so many of us. So like I said, I'm really very pleased to have Mr. Spiegel speak today, and let's give him a welcome. Thank you.
Dr. Lambiase, thank you very much. It is exciting for me to speak in front of you today and also talk about a topic about some of the positive things that are going on, some of the challenges in healthcare. And trust me, we have a lot of challenges as healthcare is evolving. But I think that healthcare is evolving throughout my 30-plus years as a healthcare executive. Started in PPS. That was whatever your costs were. You got that plus a profit, so you can invest in the infrastructure. DRGs came in, really changed that, and I think healthcare has been evolving for 30 straight years. So who is Erlanger? Erlanger is the 10th largest healthcare system in the United States. This comes out from Modern Healthcare every year. And as our net revenue continues to grow, which you're going to see, I think that 10 will probably next year look at like the 9th. Fastest growing health system by far in Tennessee. The largest multi-specialty, EMG, is the largest multi-specialty physician practice in our region. We now have 7 hospitals at Erlanger, 6 acute, 1 behavioral health. We're the 7th largest emergency department in the United States, came out by Becker's. We're right now at 145,000 visits. 4th largest interventional stroke program. 6 multi-state life for ambulances. The only pediatric level 1 and adult in Southeast Tennessee. The only children's hospital within 100 miles. And the only comprehensive pediatric hospital. This is probably the most important slide, at least to me, because I had the pleasure of presenting this in front of Congress last year. And it really talked about why our 340B savings increased. Not only is the pharmacy staff really on top of some of the opportunities, but our uncompensated care that we're providing is also growing. And right now we've provided $130 million. In this year's budget now, we're going to provide about $135 million of uncompensated care. And if you compare that to Memorial or Park Ridge, theirs is really, it's so small, it doesn't really matter. They're looking at paying patients, both in Medicare, Medicaid, and third party. Most of the uninsured is our burden. Let's look at quality, safety, and service. So someone says, oh, we're just interested in money. We're not interested in quality. And hopefully this will debunk things. Leapfrog is not a healthcare rating agency. It is for industry, the consumer, business. And they put out grades throughout the industry about how is that hospital of value for our industry? So whether it's Blue Cross, is it Mohawk, is it Shaw Carpets, is it Volkswagen? Where should our employees go? So we're a B hospital. Historically, we were a C. Memorial is now a C. And we hit, for the first time, 3 stars in HCAHPS. So this is the first time that our patient satisfaction surveys are significantly improving. Mortality, overall mortality for AMI, congestive heart failure, pneumonia, COPD, ischemic stroke, our mortality is today all-time low and improving. Readmissions, again, very successful. HCAHPS, which I showed you some of the results, we're now at the hospital's all-time high. Employed physician practice, HCAHPS, is also significantly improved. Emergency services, although we hear some issues in the emergency department, press gaining, patient satisfaction is at an all-time high. Outpatient services, again, that's everything from radiology to the lab to physical therapy to our physicians. Everything blended continues to grow. Ambulatory surgery, pretty flat. Strategic growth. Total admissions are up 3.2%. Erlanger Medical Group, 11% increase in volume. What it's saying is the increased patient access to care throughout the organization is going up and consistently. Bariatric procedures up 22%, which is really amazing. And Erlanger East Hospital up 20%. So these are unbelievable growth indicators. If you look at access to care, the blue lines are patient encounters all over. The yellow is Erlanger Medical Group. The hospital overall, in 14, we were seeing about 400,000 patients. Today, we're seeing about 1 million. So the amount of patients that we're treating, and this doesn't include everything that we have recently done by increasing urgent care centers throughout the region. We've been opening up pretty much 2 a month. So we have now 6 open, and hopefully we're going to continue around 25 urgent cares in our region. Our net revenue, when I got here, we were $520 million organization. Today, we're $1.1 billion and growing. And there's no indication or there's no hard indicator that this is not going to continue as a trend. Increasing medical providers. So we had about, so the yellow is our APPs, the blue are physicians in Erlanger Medical Group. Very strong trend. This is the same trend that you're seeing across the country. More patients are being employed by hospitals today than ever before. And this trend is continuing. And also, CMS is pushing this in some of their methodology of payments for physicians. So they're the ones who are really pushing it. Neuroscience market share, Erlanger clearly inpatient market share. Urology, Erlanger is the blue line. Memorial, since this is all internal, Memorial is the red line. So for the first time, urology at Erlanger has taken over the market position. Orthopedics, again, same trend. We are the blue line. Erlanger never had the market share in orthopedics. It was always for the rest of the community. We were a small player. Today, we're #1 in orthopedics. If you look at inpatient in our primary service area, which is Hamilton County, Erlanger has the market share by a lot, 44%, versus Memorial, which is only 29%. If you look at the primary service area and the secondary service area, the gap is even wider. That Erlanger is now at 36%, an all-time high, and that our #1 competition, Memorial, is at 23%. For some reason, Park Ridge doesn't move that much. They pretty much stay, and whatever goes on in the industry, they pretty much have that small market share of patients, and they haven't vacillated much at all. If you look at Bradley County, the purple line is Sky Ridge, and we're really focused on this. So what they're doing is they're slowly coming down, and even though around here is when we applied for the freestanding CON that was denied. So you think that all that press and everything, the market share we would be affected, but what ended up happening is the pushback from the community, our market share actually grew from Cleveland and Bradley County. It didn't go down. I found that pretty interesting. If you look at academic medical centers throughout the United States, again, versus community hospitals. Community hospitals are pretty much flat. The only thing that's really growing across the country are academic medical centers like this. Our commitment to not only train residents, but the perception across the country is crystal clear that the better level of medicine is practiced at academic medical centers than in community hospitals. If you look at what's happening here in Tennessee, Erlanger is the fastest growing hospital in Tennessee, followed by Baptist in Memphis because the Blue Cross contract left Methodist and went to Baptist, and they saw for the first time, they were pretty much down for the first time last year, a growth of 5.2%. Other than that, everything else is growth. Methodist lost the Blue Cross contract, so they dropped 3.5%. Vanderbilt, for some reason, also against the trend, because the previous slide I showed academic medical centers overall in the country are growing. Vanderbilt is down, and primarily because St. Thomas is growing. They got involved in that joint venture in X-ray and have dominated that whole metro market. And also HCA is also growing. And the Tennessee average is pretty much flat at negative 0.07. If you look at our commitment to GME, when in 14 we were 170 residents. Today we're at 185. We added 5 new programs and 15 new residents during this time. At the direct cost to Erlanger, probably about $2.15 million, and that's exact. Right now, we underwrite for the teaching programs here up and above everything we get reimbursed from Medicare, an additional $18.8 million, which is above our cap. So if you really look at some of our strategic plan, one of the things in the past that was a problem but puts us in a very good strategic position is we are the lowest cost hospital in the region by far. And businesses are starting to get more and more educated about that. But we have to implement throughput is an issue here, implement care, improve patient quality, safety, and service, and continue with our strategy because it is working. If you look at the need in this community of primary care, hopefully there are people here involved in primary care in the community, it is also showing that with succession planning, there's probably a need right now, about 100 new physicians are needed in this community. Right now, the urgent need is probably about 30, but if you really, by 2020, with other retirements happening, the only thing that we're doing is educating internal medicine, pediatrics, and family medicine. We have to kind of step up our game because it's going to be very difficult to recruit from out of the area into this area. We have to kind of grow our own. And the family medicine, internal medicine, primary care practices, we're working together to try to figure out ways, how do we increase new residents coming into this community. I talked briefly about the primary care locations that we are opening. The target areas are Ringgold, Murphy, Cleveland, North Chattanooga, Dunlap, Saudi Daisy, and Dalton. The urgent cares, North Chattanooga, Collegedale, and Ottawa, and especially with, if anybody's realized, we matched 3 physicians this year from Loma Linda because they want to come back here, live in the Collegedale area, and their families. So that's a growing trend of Erlanger aligning resources with growing populations. North Chattanooga, Collegedale, Saudi Daisy, which is open already, Cleveland, which is under construction, 2 sites in Cleveland, Signal Mountain Road, East Chattanooga, downtown Chattanooga, which is open, and Murphy, which that is also open. And we're also, if you notice, we have not really been in with outpatient physical therapy and occupational therapy. Those are actually opening. It's needed for our orthopedic practices, and so that is going on. Excuse me. Bradley County, 2 locations. Paul Huff, so it's going to have urgent care, primary care, rotating adult and pediatrics, and physical therapy. New downtown, in the shopping center where Bald-Headed Bistro is, right there was a Greenfrog bank. That is now leveled. Construction is going on and building a medical office right there adjacent to Starbucks. And you're going to start seeing our investments in target areas where Erlanger has never done stuff like this before. It's a huge building in Cleveland, and these are pretty recent photos. So the construction is going on, and this should open up the first quarter of next year. And that's what the building is going to look like. So we're opening up first class, wonderful stuff. In Murphy, this is an adjacent town that one of the other hospitals has been drawing patients out of Murphy into Hayesville. So we opened up a market there. And Ringgold, this is open. It's unbelievable. The express care. If anybody had the opportunity to go there for the ribbon cutting, and even with the past history of Catoosa County, they gave me the key to the city this week, which I thought was pretty ironic. But we went there, we invested there, we told them we would, and we actually came through. Ringgold is continuing. Murphy, we're going to be putting more urgent care and access to care there in Hayesville, and rotating primary care. And for all the physicians in the room that have been going to all these sites, thank you, because without our physician partners in these facilities, the communities will not be sending the patients. And ultimately, that is part of our growth. Hayesville will be open. That's under construction. I think this is open already. So our 4 core strategies are to improve quality, safety, and service, advance operational excellence, improve access and drive service line growth, which we've been very successful in, enhance physician and associate engagement, and improve our financial performance. We have been investing a lot of money back into the infrastructure instead of just putting it in the bank. We've been investing it in expansions, but at some point we have to start building our cash reserves. Market trends, we're starting to see across the country and locally continuing to shift to value-based payment models. We're going to see a whole lot of pressure from very large employers. Walmart is leading the charge, but you're going to start seeing other big employers like Volkswagen and the carpet industry, Mohawk and Shaw, to look for better models to reduce their costs. There's going to be increased risk in value-based payment models, some of them very risky. Demand that the health system become more efficient. Focus on the need to identify and eliminate waste within the system. And align service volume growth with our expense growth. So we're in a risky time. When you start growing that fast, financial viability has to be job one. And focus on improving quality and the patient experience. And so far, we have seen wonderful trends from HCAHPS that patients are enjoying it. And the other thing is physicians and patients are choosing Erlanger. They're choosing this place. Moody's is one of the reviewers of our bonds, but most healthcare bonds. They looked at 43 academic medical centers in the United States. 2 had positive outlooks, 9 had negative outlooks, and 32 were rated as stable. And Erlanger is BBB and is stable. And it looks at a million indicators. But we recently, Britt Tabor, myself, recently went to Wall Street 2 weeks ago, and we met with them as we're starting to look at refinancing our bonds so we can build a new tower. And in the analysis, they said two things. If you looked at all the Moody's profiles of debt to net patient revenue, what is the percentage of income that you're making every year versus the debt you have? The number one debt health system in the country is a Tennessee organization called CHS. Their probably debt structure, because they also get private equity monies, about 90+% debt to their revenue. Erlanger is one of the lowest. We're about 20% debt compared to our net revenue. So we're probably under-leveraged. So going to the bond market would pretty much be pretty easy. The last time we went to build the Children's Hospital, to build East, to build Heart and Lung and Orthopedics, that, when we went there, when we hit the bell on Wall Street, we issued our bonds and we sold out triple. So we could have sold 3 times that amount, which I found interesting. And we got A-rated pricing because they believe in a story, and they also believe in a hospital that is taking market share. So what is going on? We're now July 1. We're in a new fiscal year. We're now in fiscal year 20. So what is our game plan? So we're positioning Erlanger for the next phase of growth. We assure sustainability, expense management, and savings. Align our service volume growth with our expense growth. And fiscal year 20, balanced growth projects. Focus on improving quality and patient experience and continue to invest. We're investing about $38 million this year alone in capital, patient equipment and capital, which is absolutely needed because you remember before I got here, we were not investing in capital, in infrastructure. And you do that for 15 years, we're still in catch-up mode. Future plans for the Children's Hospital Phase 2, which is why we were on Wall Street, and the adult tower. The adult tower will house about 120 critical care beds, which is absolutely needed. One of the things that is really harming this hospital and its reputation in the community is patients waiting in the emergency department for beds upstairs. Number one reason, the right bed. And so we have to figure out, in this project, the Children's Hospital has to be needed, but adult tower as well. And it will solve the problem probably for the next 15 to 20 years. And should we be building inpatient towers? Well, the healthcare economists over the last 30 years have predicting everything is moving to outpatient. Well, in reality, especially the people, everything is not moving. Everything is moving to outpatient and critical care. And we need to really be providing a center of excellence where critical care beds are here as the infrastructure. Children's Hospital is our job one, and it is the thing I'm most focused on, and also regional opportunities of partners. So Adventist System is trying to partner with us. We have a meeting with them tomorrow. They have Gordon, Murray, and Park Ridge, not here, Park Ridge in Asheville. Also, if you look at what was budgeted, so we have modest budget for this year, 4.4% inpatient growth, outpatient growth of 5.1%, and ER visits 1.5%, which is almost saying it's going to be flat for this year. And hopefully, if there's any additional revenue over expense, that will go into cash in the bank. Now I want you to see the new tower that we're going to be building and how that's going to actually work. The bottom portion, the top portion is the new Children's Hospital. That's going to be on the corner. In between, there's a building here, there's a building here, and there's space here. And believe it or not, they're going to put this right in the middle. and then they're going to take down those buildings. And the top 6 floors are going to be the new Children's Hospital, and the bottom 6 floors are going to be the Adult Center of Excellence Tower. So the upper 6 floors with 120 private rooms, but they're going to be built as ICUs. So we have to update the slide because we already changed the plan from 96 rooms to 120 adults. Essential to improving the patient experience because, you know, Memorial has new beds. And once they built them, they lost their market share. But we have to now expand. The project is going to be about $200 million. We're probably going to look between $40 and $50 million for fundraising in the community. And we now have a track record. If you remember, when we built the Children's Outpatient Center, we had no track record of raising money. And we were very successful, and actually we raised more money than our goal. So again, this is how it's going to lay out for the hospital, and we'll probably have to adjust some of those numbers to be consistent with the new trend. But that's exactly what we have going on. It's a lot. There's a lot of things going on in the organization. One thing I realized when I first came here is you cannot control the press. So somehow the story, and I did this slide deck for the editorial board, and usually they write about 6 articles. After they read this or saw this, asked questions, no articles came out. You know, so Erlanger does sell a lot of newspapers, but somehow we need to be communicating what's really going on in this institution. And this time I'm going to kind of open it up myself, Dr. Lambiase. If you have any questions, I am here. Now's your chance.
I'll start off, Kevin. Thank you for coming and speaking with us. I had 2 questions. The first one is you said that the academic medical centers were the ones that were growing recently, and that's where sort of the growth is. I wonder if you could touch a little bit on the value of that, and then also why are some, like HCA, getting into the residency business without universities and that sort of thing?
You use those.
Yeah. So I mean, my first question was
absolutely. I'm going to talk about HCA because I have met with them. You know, we rotate our residents not only to Memorial, Park Ridge, and some others. You know why? And Park Ridge made it clear they're not going to want to pay for it. Why is HCA the fastest growing, and I use this word loosely, academic medical center in the country? Because they figured out a loophole that if you have a virgin operating certificate that you can apply to the RRC and ACGME, CMS will approve it. And they will not only approve the slots that you request, they will approve all the faculty support. Ours was locked in 1974. And in 1974, a lot of our faculty were voluntary, and there was no cost to that. So it was not included in our base, but it's locked in. HCA has an opportunity to include as much faculty and overhead as they can, not give it to a university, but do it themselves and create training programs, but keep that revenue for themselves. And so they're expanding and they're opening up programs. But just so you know, we are also looking at growing training programs. There's an opportunity in North Carolina at Murphy, and should there be family medicine. And yesterday we were exploring with Dean Shack, should we be also looking at providing rural family medicine program in the Sequatchie Valley and in Dunlap, and then have those residents for some of the core required rotations coming here to Chattanooga for their experience. But the cost would be paid for by by CMS because that is also a Virgin CON, and it's not tied to our operating certificate. But East is on our operating certificate, so that is not allowed. So, but Sequatchie Valley is separate, and so is Murphy. So if we get other community hospitals, there is other opportunities to expand.
Thanks. And then the other question I had was strategic around growth. You know, there are people who say, well, you know, Erlanger is Chattanooga's public hospital. So why the pressure to grow? Why the strategy to grow? And why not just stay in Chattanooga and do Chattanooga things rather than grow the enterprise?
Yeah, and again, those are interesting comments. There's been investigation to look into our original, you know, the Authority Act to see are we even allowed to go outside of Hamilton County. The real reality is the payer mix in Hamilton County is the worst payer mix we have in anything we're doing. So if we just got rid of everything else we're doing and just stayed here, we would be non-viable, just like the Med in Memphis and just like Nashville General. The good part about us is we started years ago with the helicopters, those bringing better payer mix patients into our region, and now what we're doing is providing better access to care for patients who would have to travel. Our biggest argument was in Cleveland. Does anybody have any idea how many ER visits Hamilton County receives from Bradley and Polk County? Over 22,000 patients per year leave their county for two reasons. One is they do not have confidence in the hospital in their own community, and two is they're seeking others. And they go to Piedmont, they go to Memorial, they go to Park Ridge, and they mostly come here. But it's a problem. They believe that if you go from Bradley County into that hospital, you're probably uninsured. And they don't want to provide that level of care. They don't want the strokes. They don't want the AMIs. They don't want the congestive heart failures. They want those all to leave. And they want private doctors in the community to admit patients there. So what do? They provide a choke point at the ER. They have more beds in the ER, but they close them off, and they make patients wait, and that's caused all those patients to leave. And it's a profitable environment at that hospital, but it is not serving the community. And we are a public hospital. We're stepping up. We believe that the answer in Bradley County is to provide a freestanding ED there. We have made offers to buy that hospital, but they're just, at this point, they're asking too much money. Anybody know what, 2 years ago, what CHS stock was trading at? $60. And today, it fell, this week, it fell for the first time below $2. So, you know, the question is CHS viable? HCA has been looking and shopping it. So has other for-profits in Tennessee, and I think they've taken the position they're not going to buy. They're going to wait for them to fail. And that's why, and if anybody knows, the cardiologists in Cleveland, there were only 4 at the hospital. 3 of them joined us, and 1 left the community altogether. So they're having CHS doctors from Knoxville just covering it. They put an ad in the paper, and they showed 20 cardiologists that are now coming there. But in reality, what they're doing is it's 1 doctor covering the hospital on call 1 at a time. So they're not doing the job.
Anybody else?
That's a very good question. When will the tower be complete? It's a 2-year construction project. It will probably wait till next year. We have to see how we did this year on our close. Do we go this year, or do we wait another year to have 2 good years? Last year was with the Epic. This year is also contaminated with Epic. But right now, our reputation and our branding is very good. Do we go to bond market this year, or do we wait another year? But you have to go to Wall Street, float the bonds. That's probably a year and about 2 years of construction. So it could be anywhere from 3 to 5 years. 5 years on the outside, I don't want it to go there. I know I can sell these bonds, so we got to figure out what we have to do.
Any plans for MITU?
Yes. Oh, yeah. Oh, no. They're going to be universal critical care.
I saw neuro ICU.
Right. But they're going to be universal beds. So we're going to try to figure it out, and I'll convey that. Yeah, because if there's a choke point in the ED, it's critical care beds. We got to provide that outlet.
The only other thing is that the tower is so far away. You know, your CT scanners, your MRIs, how are they going to travel across the street?
It's not going to be across the street. It's going to be on our side.
Okay.
Right.
Okay.
Yeah, no, it's going to be really close by. This is much closer to it.
I thought it would be in the OE, over the children.
No. We're going to build, because you got to remember, the children's is outpatient. We're building, it's going to have actually 2 separate entrances for the adult and children. So you'll come in on the ground floor on the children's side, and it'll go up. The first floor will be the 6th floor. So the top part will be the children's inpatient. We're neonatal. We may have women's in there as well. And then the bottom will be all critical care for adults. Not med-surg beds, all critical care.
Any other questions?
So Erlanger is in the best position it ever has been in. We have areas that we really need to improve upon, and that's access to critical care beds. We have a plan, and hopefully we'll execute it. Thank you for everything you do, educating our residents, because they're the future doctors for tomorrow. We're committed to academic medicine. That's why I'm here, and that's why I know you're all here. Thank you.